Hi everyone, and thank you very much for coming to our veterinary medicine panel discussion. Can you hear me okay? Yeah? Closer? Oh God, okay, yeah. Okay, so my name is Kate Burke. I'm the head of department for veterinary medicine at SETU. I'm going to introduce you to our lovely panelists here on the left. So we have a member of our veterinary academic team, Eilidh Thomson. Eilidh is a European specialist in animal reproduction. And then next to Eilidh we have Lucy Jerram, or Lucy the cow vet as she's Insta famous. Lucy is also a European specialist in bovine health management and is a practitioner at Highfield Veterinary. And then last on the panel is Emma Corbett-Coffey, another member of our academic team. And Emma is an advanced practitioner in veterinary surgery, in small animal veterinary surgery. So we'll get right to it, I suppose. So obviously in the veterinary sector, like a lot of industries at the moment, it's a time for significant change. And with all changes comes, challenges and opportunities. But I suppose we'll start on a positive note with the opportunities. What do you guys think are the biggest opportunities that you are seeing in the veterinary industry today?
I think the opportunity for having a more herd health preventative approach instead of the sort of usual fire brigade going out at 2 o'clock in the morning to do cesarean sections. So being able to just look at genetics, breeding, and sort of solve the problem before it starts.
Great.
Yeah, I agree completely with Eilidh there. The more that we can build a relationship with our farmers, so that the vet is part of that whole decision-making process, spending the money before the problem occurs probably is significantly more cost-effective and a great use of our vets. We're training vets a lot more for that kind of herd health approach and helping them manage their farm with all the other related industries. So using the vet as part of the team is important.
And I suppose from a small animal point of view, small animals and pets have become very popular in Ireland over the last 20 years. It's not just your farm dogs anymore. We have pet parents coming to us wanting the best for their small furries and their furry children, essentially. And as a profession, we're expected to be able to do more for them. And we can, fortunately, because there's lots of advances in technology in small animals. We have a lot of opportunities to kind of vary the amount of care that we're giving. And we're more advanced now in preemptive and preventative care as well for like older pets and vaccinations and everything. So we're seeing less and less of preventable illnesses in our small animals as well.
Great. I suppose it comes back to the old thing of prevention is better than cure, isn't it? So it's great for animal welfare that we can stop a lot of these problems before they become problems. So maybe some more of the challenges then with these changes, and a big one that we can't avoid is legislative change. So it can be a little bit difficult to navigate sometimes, but unavoidable. What do you think the biggest impact these legislative changes are having on veterinary practice? And if we are then to look with a nice positive outlook, what can we employ strategy-wise to kind of help the industry adapt to these changes?
Certainly from a farming perspective, this year we've seen something called the NVPS come in, which is a virtual digital prescribing recording system. So now anytime I prescribe any prescription medicine to a farmer or a horse, we have to record that and report it directly to the department, which means we're undergoing a lot more scrutiny than we maybe ever were before. It's a lot easier for them to check up on us. But I think with that comes that better awareness of what we're doing, potentially better reporting on that kind of thing. So we're maybe just a bit more aware of what we're putting out there, and it might just help us check ourselves and maybe check in with those farmers that are buying more antibiotics than we might expect them to. So opening a narrative that we maybe didn't have before. Yeah.
Knowledge is power, I suppose, isn't it? So the more you know, the more you can help. Emma, is there anything from a small animal perspective in relation to legislation that you can...
Yeah, so I suppose the NPVS is going to come for small animals eventually as well, like with antibiotics. anti-parasitics and things like that, because there is environmental concerns now as well for the use of like spot-ons and small animals washing into waterways, and we have to be very conscious of sustainability as well throughout for a One Health approach to I suppose veterinary and the environment. And also I suppose legislatively the Veterinary Council of Ireland have also they're restructuring their accreditation standards for both premises and for centres of education. So it's really useful that we're at the beginning of this phase, so we can adapt the course to what they need and what we need for the future of vets in Ireland as well. So it's a really good time.
Yeah, absolutely, and that kind of leads on to my next question. So a lot of these legislative changes are really focused towards that One Health approach, which is kind of the intersection of animal health, human health and the environment. That, you know, if an animal is going to be healthy, then all the humans and the environment around them need to be healthy as well. So what, I suppose, in your day-to-day, and all of you have quite different roles now, what do you think the most pressing One Health challenge is for yourselves personally in your veterinary careers?
I suppose in small animal practice in particular, we would be quite conscious about the amount of waste that we produce through consumables, anaesthetic gases as well, which are greenhouse gases, and there's ways and means of trying to reduce that a little bit as well. And also antimicrobial resistance is a huge problem both in large and small animal, and it has a huge impact on human health and also the environment as well, with runoff and you know, excretion of antibiotics into the environment. So that would be the kind of the top two for me anyway.
Yeah, so definitely climate change for farming as well, with the amount of methane emissions and things. So definitely looking to do more research into that and find out how we can reduce that. But again, the One Health, like, it's so important for the environment and then therefore humans. So I think everyone, vets, doctors, have to get involved.
Yeah,
and farmers.
Yeah, it's a team effort, isn't it? And I suppose that's really a hot topic with you know, methane and nitrogen degradation and all of that. So I suppose on the ground, Lucy, are you seeing that that's really affecting farmers and worrying them?
Yeah, certainly anytime we're having a chat about plans for the farm, the number of animals they're able to hold on that area is top of the list of reasons why they might be downsizing or why they might be looking at moving heifers off farm, or, you know, kind of management decisions are inherently tied up in how they're going to fit their environmental requirements. So yeah, that's a challenge. We also are doing a lot of work on kind of parasite control at the moment. So if you're really stocking your land too highly, you're potentially at risk of more parasite burdens. And with that, we worry about resistance to anti-parasites just as much as resistance to antibiotics. So it's another thing we're getting really involved in as vets, and using vets as part of that rather than just maybe going to the co-op. Yep.
Absolutely, and I suppose what we need to get better at, and see it in the equine industry as well, is not relying on just the drugs to manage parasites and worm burdens, but employing those other techniques as well. How do you think they're being received within the industry, or, you know, veterinary and agricultural industries? Is it a challenge, or?
I think it's if you've always wormed the second week of July every year for forever, it's very hard to change that approach. We've seen within our practice, but across the country, we've seen a great uptake this year in an initiative called a Parasite Taza, which includes a worm egg count as part of that. So just starting to build an awareness of the genuine worm burden in those animals, and whether they did need dosing at that stage, or whether they do need dosing, and how effective the doses are. And it's great to have that funding coming from above and filtering down, so it's not costing the farmers anything to get the vets on farm discussing that at that stage. And there's one for equids as well, so again, getting the horses more involved. It's very normal to just worm the whole yard on a certain day, and trying to get away from doing it by the calendar and thinking about other things is really important. Yeah.
I suppose we can all be creatures of habit, can't we? We like a routine, we like doing the same things, so it's great that there's the mechanisms there to kind of start those conversations. And I suppose a lot of it comes back to just changing that attitude together, isn't it? Like you said, back to that teamwork. I'm going to slightly change track now a little bit and talk about technology. AI is one of those things that we're all kind of a bit skeptical of, maybe. But
Not insemination.
Not insemination, artificial intelligence. Sorry, that's always going to cause confusion here. Thank you, Emma. But it's definitely something that people are a bit maybe nervous about or apprehensive, but it's coming in thick and fast. I think we're going to have to embrace it at some point. So what way is AI, and I suppose technology generally, we won't kind of just pigeonhole you into talking about AI, how do you think it's influencing your work at the moment, what you're doing day to day?
So I think the main thing is the sort of collars and the monitoring systems in dairy herds to monitor everything from fertility to health to how much they're eating. And then that just feeds into, again, as you're saying, like the knowledge of the cows themselves, the systems and how it's working, and then if the things that we're doing are making a difference, basically. And it means that you can understand a lot about a farm before you're even on the farm.
Yeah, I was in the innovation tent earlier just having a look at what else is out there, and quite a lot of us would use collars or pedometers and have done for years, but the innovations of what those collars can give us now, telling us about how much the cow's eating, sleeping, moving, how well she's digesting the food, as well as just telling us when she's ready to be served with the other kind of AI. But even there's boluses down there that are doing the same thing, so they sit in the rumen. Just the amount of data that we have is incredible, and for any of the farmers that have apps on their phone, they're getting that data straight to their phone, they're able to share that with you. I'd quite often get sent a screenshot of something, and like Eilidh said, you're starting to treat the cow before you've even seen the cow or build up that picture. It's helping us holistically, yeah.
It's really good preemptive care, isn't it? It's really good preventative health care as well. We're not firefighting as we used to be. And I suppose in the small animal side of things, diagnostics has really advanced. We're using AI in everything from x-rays to blood machines to looking down microscopes. We have machines that can do that for us. Obviously, we have to make sure that the results are, what we're seeing in real life. But it really is helpful to be able to do all of that in a general practice and not have to refer out. We get results there and then for your pets, and it really, really helps to inform care a lot faster and, again, preemptive, of any problems that are going on. And also things like therapeutic monitoring. I don't know if people are aware of the Freestyle Libre for diabetics. For diabetic people, we can put them on pets as well, and it's better welfare for the animal. They don't have to come in for glucose checks every so often, which is a needle every time. So it's actually increasing welfare in our pets, having the technology there to be able to say, oh, that's what the glucose has been doing for the last 2 weeks. This is what we'll do with the dose. So it's really, really helpful.
Yeah, multiple benefits there, isn't it? It's more of that information which will inform the care and have a positive impact on welfare, but like you said, down to the practicalities of not having to jab them with a needle every time they come in, so the next time your dog comes in, it's a pleasant experience at the vets rather than being another injection or whatever. So we'll go on to, I suppose, what is a big topic in the veterinary industry and has been for a while, which is the retention of vets, particularly in large animal practice. What do you guys think are the key things that are, the reasons why we can't retain vets, or maybe sometimes the reasons we do retain them in some areas? What are your thoughts on that?
So I think, like you say, large animal is probably the area that suffers most from this. Particularly if we go to the west of Ireland, you're dealing with, huge gaps in care there. It's lonely, and potentially they're working in a kind of a fairly small practice, so they may be on call a lot. The work-life balance is quite poor. So it's just trying to look at ways to improve that work-life balance. One of the things that some practices are doing now is they're maybe sharing their on-call rotas with another practice. So there's an understanding that you're not going to be stealing each other's clients out of hours, but it means that you go from being on every other night of the week to maybe just being on once a week, and that kind of level of work can just really help maintain you in the industry and remember why you love it and make you love the lambing rather than being frustrated that it's yet another lambing in the middle of winter. So working together and remembering we are all part of the same profession is sometimes the first point of it.
Yeah, work-life balance is a huge problem, has been a problem for forever in veterinary. And I suppose being a female-dominated profession as well, we have to sort of mention that, you know, having families is quite difficult to maintain your career, along with having children, childcare, and a lot of, you know, especially the large animal side of things as well. I myself have had to give up the large animal side of things for childcare. And it is difficult to balance, but I think practices are becoming more aware of that now. We are seeing more part-time options, job sharing, things like that, and also practices that you don't have to do out of hours if you can't. And again, sharing on-call rotas is a huge part of that, to try and share out the workload.
Teamwork seems to be the kind of key word of the day for a lot of the issues and challenges we're facing in the veterinary industry, but absolutely just flexibility and teamwork is going to be really important, isn't it, in terms of retaining the profession. So I suppose from our end as a university that's going to have a very exciting new vet program next year, what role do you guys think that education and practice can play together, again, working as a team with this issue specifically?
I think, yeah, like obviously, like it's good to get more vets in the system, but also maybe teaching them a bit more about resilience. Like obviously all the things that Lucy mentioned, like it's not easy, and it's not saying that this will solve everything, but just being aware of what you're going into before you go into it, I think would really help, and teaching them to deal with, maybe not easy calls out in the middle of the night and things like that, to make it a bit easier to deal with.
Yeah, and I suppose with the newer courses and the new accreditation guidelines, we have to have mental health, well-being as part of the course, kind of holistically embedded into the course. Business management, communication skills, they're all really important. Soft skills, not just your clinical skills, and they really help you be prepared for the veterinary profession and being a professional, and also interprofessional learning as well with our veterinary nurses, which are hugely important, and other paraprofessionals within the team, of course. And learning about those early on, having the interaction with them early on, is a really important way of being prepared for working with them when you go out into practice.
Sorry, just to jump in there, completely agree, because it is about giving graduates those skills that are not just the medical and surgical and diagnostic skills, but there's a lot to being a vet, around communication, and it can be, you have the highest highs in veterinary, but you can have some lows and there can be some tough days, so being able to deal with those and roll with the punches on those days. From a practice perspective, Lucy, is there anything, as someone who would be hiring new graduates, that you would especially like to see them have, skills-wise?
I think it's easy when you're in a university, and particularly a higher level referral practice type setting, to have a load of vets coming out that think they're going to be doing the next cutting edge thing all the time. A lot of our day-to-day work is TB testing with the same pair of guns and calipers and just running animals up a race, and that's inevitably, we can't get away from that, and other routine things of that nature. So better awareness of like first opinion practice for me is really important, and working out how else you're going to feel fulfilled. The people are such a big part of our profession, particularly I know on the small animal side, but on the farm animal side, you might only spend the day with 5 or 6 farmers. The whole day you're going to spend a lot of time with them. You really start to know a lot about them and their families, and if you're not interested in people, actually it's probably not the profession for you. So seeing that kind of, I always say I can teach them all the clinical skills, but if they come out and they're not enthusiastic and able to talk to a wide range of people, then they're probably not the person I want to employ.
Yeah, absolutely. And I think, some people say that's a personality thing, but I think there's actually a lot of skills that you can learn and techniques you can teach people to be able to adapt to different communication styles and things. And I actually think the people can be some of the most fulfilling parts of the profession in terms of the positive impact that you can have on, you know, farmers and their families and clients and that. So definitely. Around the routine work that Lucy was talking about there, what's your perspective on how can we teach that in an exciting way, or what do you guys think as the academic team is the best way to keep that enthusiasm that Lucy's talking about the routine, everyday veterinary medicine?
Yeah, I mean, you can't jazz up TB testing really, but I suppose, and vaccinating dogs. I mean, the puppies are cute and all, but it can be mundane. But I suppose having the unique selling point, I suppose, of our veterinary program is that our rotation year is spread throughout the general practices in the area. They get real life, real experience of first opinion veterinary in their final year. They're actually doing the job. Whereas I suppose the teaching hospitals are great and you get to see all the fantastic advancements that we can achieve, but also you need to be excited about what you're actually going to go out and do. And I think, I believe that the new grads will definitely be excited about that, even if they have to do vaccinations for the first 6 months. It's still part of it. You're still meeting the clients, you're still seeing the animals, and that's the exciting part about it.
Absolutely. It's, again, that impact on the people and the positive impact on the welfare of the animals as well. I think that's all we were going to chat about today. Thank you very much, all of you, for joining us.
Thank you.
And yeah, feel free if you want any further information about the programme. There's leaflets there. Ask any of us any questions, or if you just want to have a chat generally. Thanks very much.
Thank you.
Thanks.